So what does the surgery actually feel like? Am I awake, or do I feel anything? Is it
Another
scary?
great question. Another great question. It definitely varies from surgeon to surgeon, surgery center to surgery center. You know, if you go back decades, there was a time where all cataract surgeries required you to be admitted to a hospital and you would stay there for days to maybe a week.
Wow.
The surgery recovery time could be, days, weeks, or longer. And nowadays, it's minimally invasive. It's typically done under conscious sedation. So we give you a little Versed, kind of like Xanax or a benzodiazepine to relax you, ease your nerves, and then numbing medicine on your eye, in your eye. And for most people, that's sufficient. I will say there are those who are more nervous, or maybe they have some other comorbidities that would make it difficult for them to lie still during the procedure, which typically takes around 10 to 15 minutes per eye. And for those, some people do need to be under general anesthesia, but that's certainly rare. That's not the norm.
So what happens in the 10 or 15 minutes? It sounds like 10 or 15 minutes.
I
Sometimes I have
know.
a snack takes longer than that.
I know. And a lot does happen, and certainly there are many videos on YouTube that you could check out. But, simply put, the cataract is located inside of the eye, which a lot of people don't know. Some people think it forms on the outside of the eye. It's inside your eye and it's behind the colored part of your eye, the iris. So we have to dilate your iris. We put some dilating drops in to make that black hole in the middle of the colored part of your eye nice and big, and that gives us better access to the cataract. And during the procedure, we basically make a couple of very small incisions. We're talking, a couple of millimeters on the front part of the eye. We go through those, make a small opening into the capsule that the cataract sits in, and then we use an ultrasound device called phacoemulsification to break apart the cataract and remove the pieces. And after it's removed, we replace it with a clear lens implant that goes inside of your eye, and that helps focus light to the back of the eye. So lots of little steps in there. Most of the time, thankfully, it's fairly routine. There are a variety of, anatomical variations that can make that process more difficult. But thankfully, by and large, most people do very well with it.
So if a doctor says, so my doctor says, we have these premium lens and they cost extra.
Yes,
But what am I actually paying for if I get a premium lens? Is
Zane, these
it
are
really
great
premium?
questions. These are great questions. So this field has really exploded. I think the first premium lens was offered sometime in the late 2000s, like maybe around 2010, give or take. And since then, it has exploded. The original lens implants, they had a lot of side effects. They have to bend light into multiple focal points so that you
Hmm.
can see at multiple distances. The standard lens implant is what we call a monofocal lens implant. And so typically with that, we can target good vision far away or up close, but you can't have both. So you have to choose. Most people choose, I'd like to see better far away, with the expectation that they'll need something like readers to help them see up close. But for
Right.
people who want to reduce their dependence on glasses, contact lenses, they have a fairly active lifestyle, maybe they do a lot of water activities, these premium lens implants allow you to see at multiple distances without the need for glasses or contact lenses. And again, those earlier versions of the lens implants, they had what we call dysphotopsias, so a lot of issues with light. People would see like starbursts, halos, glare around them. And with the more modern versions that have been released by a number of companies, Alcon, Bausch and Lomb, J&J, uh, the side effect profile has become much more favorable. And by and large, most people tolerate these lens implants very well. And it's really nice to just not have to depend on glasses or contact lenses for the majority of your activities.